everybody. Welcome to In the Know with Nina. I'm Dr. Nina Crowley, your host, and I'm the Director for Clinical Education and Partnerships at SECA, where we partner with healthcare providers to offer body composition solutions. Today, I'm joined by Sejal Desai. She's an obesity medicine physician and has a direct specialty care practice in Houston, Texas. And she and I were just at the Obesity Summit for the Obesity Medicine Association Summit, and it was here in Charleston. So we had a really great time and got to talk a lot about women's health. And so I asked if she would come on and talk with us about some of the main lessons that we learned and some interesting topics to explore further. And this is kind of in your area. So tell me a little bit about you and how this connects for you. Thanks for being on.
Yeah, thanks for having me, Nina. It's great to see you in person and great to be there in South Carolina. It was a beautiful venue and location. Yeah, this was absolutely my passion. I'm originally family medicine, so I did that family medicine for about 20 years, and about 10 years ago, I got board certified in obesity medicine. And 10 years ago, as I was starting this perimenopausal transition myself, I really started getting more and more interested in women's health and especially weight surrounding our health. And so that kind of led me into, really somehow our patient population is kind of, just becomes what we're most passionate about and what we might be going through in life sometimes as well. And so I feel like majority of my patients started just coming to me. It was like women who were, going through this transition and gaining weight, and especially around the midsection and not feeling well. And I just really started becoming more and more interested in this. And so I would say my practice mostly focuses on postmenopausal females and really just empowering women to embrace this transition, really learning and gaining more awareness about what our bodies are going through during this time so that we can then make those changes and be proactive and prevent some of those long-term complications, right? This doesn't have to be a time of struggle. It can be a time of vitality. And that's really what I want to, try to impart in my patients. And we can do that through many different treatments. So it's been exciting. It's been a journey. And I opened this practice. It's called Tula Medical. And Tula means balance. And so
Hmm.
for me, that's the balance between your physical, mental, emotional, and spiritual health. And it all has to come together for treatment and for us to live a long, healthy life, that health span, not just lifespan. So I don't like to say I'm just a weight loss doctor because I feel like I do way more than that. My real passion is really preventing chronic disease.
I love that. And the balance and vitality, I think, are not usually the words we hear. I think people tend to focus on the negative. So I appreciate that in your practice. And you're in a direct primary care model, right? At this
Right.
point,
Yeah. Yeah. Direct specialty care, I call it,
specialty
because
care.
so I left traditional medicine many years ago because I felt that it just wasn't allowing me to spend enough time with my patients. It was like, bam, 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 patient after patient, rushing in and rushing out. And it wasn't serving them and it wasn't serving me either. I felt like this is not the right way to practice medicine. I have so much information I'm learning on a daily basis. I want to be able to impart it onto my patients and be able to give it to them. So I just started my own practice. Initially, the first few years have been fully virtual. I can see patients anywhere, and we, work on changing lifestyle, really, improving lifestyle in a personalized way because everybody is different, right? And every patient is different, and so we focus on the things that my patient needs, and I'm able to spend as much time as I want with them, so the visits can be longer, more frequent visits. This is what's really needed. I can't just impart everything I need to tell you in 15 or 20 minutes every 3 months. That's not how, a true effective long-term health and chronic disease prevention works, or weight loss works for that matter. True healthy weight loss, right? So I really like to be able to have that time and be able to explain everything properly and be available when they need me. So that's really why I went to that model where I don't take insurance. It's cash pay. You just pay for the services that I provide.
Mhm. And you're getting an in-person location, a new one, or?
Yes. So I've been fully virtual this whole time. I am in the process of building out the new office, and we're almost there. It was supposed to be ready this summer, and one thing after another. But we're hoping in November we should be closing, and then hopefully opening up pretty shortly after that. So it's really exciting. I'll offer both at that point. Virtual, of course. I love virtual. I think it's a great way to reach so many people who don't have access to healthcare. And so I'll always keep that. But I love seeing my patients in person too. I miss that so much. So I'm excited to be able to have both.
And I know for you too, being able to offer body comp in your practice is going to be a part of opening the in-person location. So I love to hear that too, because I think it's hard to do that in the all virtual practices that I've seen.
It is hard, yeah. And we do it, at the best we can. I send them places, or sometimes we do like the home scales, but it's not, I have my Sika, like literally it's sitting here waiting for the office to open. And then I cannot wait to put it together and start using it because, I'm a big believer in body composition. I honestly, personally, I'm a big believer in body composition for everybody. I was even doing it when I was practicing primary care. I really felt that everybody needs to know when they come in for a physical, this should be part of your physical, right? Knowing not just what your BMI and weight are, but really knowing more detailed information about visceral fat, muscle mass, all of those things. Everybody needs to know.
Yeah. Well, that's actually a perfect segue because I was going to ask you, one of the speakers that we listened to over the weekend was talking about the menopausal transition. And so, we hear a lot about body composition shifts, particularly around, of course, abdominal fat, decreased lean mass. And so I thought maybe you could start there with letting us know, how does that affect health? How do we compare between someone who's premenopausal, postmenopausal, and sort of how body composition, enters into that transitional phase of our lives?
Yeah. So this is so important, right? Because as women go through this menopause transition, and perimenopause is really just those changes, the hormonal, fluctuations that are happening with estrogen and progesterone can cause lots of symptoms. And one of the symptoms is abdominal fat accumulation, right? So we have an increase in fat around our waist area, which tends to be more visceral fat, which is the fat that's around the organs, not just the subcutaneous fat, the visceral fat, which is what we measure on a body composition machine, is important because that is then what's going to cause the chronic diseases long term. Visceral fat that can get around our, liver and pancreas and heart, even muscle, it can invade into our muscles. All of that is pro-inflammatory, right? So as this transition happens, we are, getting more visceral fat, which is becoming more inflammatory to our bodies, and it leads to things like insulin resistance. Because the second thing that's happening is that our muscle mass is declining. Right, so we're having a decline in muscle mass and an increase in visceral fat, all due to this estrogen fluctuations, because estrogen affects really everything from head to toe, right? But it definitely affects these two big areas of muscle mass loss, lean muscle loss, and the visceral fat, which leads to insulin resistance, which is kind of that precursor to diabetes. It's a vicious cycle. This then causes more fat accumulation. It becomes harder to lose weight when we have insulin resistance. And that muscle mass, it just continues to decrease as we go through perimenopause and postmenopause. And at this time, abdominal fat, the visceral fat, makes up a significantly higher portion than it did pre menopause. And I think most women that are going through this transition can tell you and corroborate to that. It absolutely does. And it is, then leading to all of these chronic diseases. So then that insulin resistance can lead to diabetes, which can lead to cardiovascular disease as well, which we know increases, all of those things increase for women post menopause. So it's incredibly important to get on top of all of that ahead of time, early on, so that we can prevent those long-term complications.
So yeah, in your practice, I mean, you deal with this most of the time. So what kind of things do you do when someone's presenting, kind of earlier on? And I think one of the things you said up front was normalizing this and explaining it too. I think a lot of people, peers of mine too, are just they're sort of shocked. They don't really know that this is happening. And so they think it's just them. So I can imagine that, normalizing this is happening, explaining how, the body works. And then, probably most importantly for the patient, figuring out, what to do if they're not, if they're not happy with those changes and they want to make some change to their body or to their lifestyle.
Yeah, that's a good point. And the first thing you said is so important is really normalizing it and validating each other, right? Because
Yeah.
this is not something women just tend to put up with this stuff. We just say, we just put it aside. We don't have time for it. We've got, maybe kids, maybe parents. We're taking care of that sandwich generation. We're working. We're doing, 100 different things. It's a really busy time in our lives too. And we just either tend to not even be aware of the changes that are going on, or we just say, it's okay. I'm going to get over it. I'll get over it. It's nothing. It's not much. It's just a little. So I think really, taking a step back and really saying that this is something that is happening to your body, and it happens to every woman if we're lucky enough to live long enough, right? We all are going to go through it. So it does need to be normalized. And we also need to learn, like I said earlier, is that this doesn't have to be something you have to suffer through. So, that's the first thing. There are many different ways that we can help. And first of all, it does, of course, have to be individualized to the patient. As with anything in medicine, I think it has to be. There's not a one size fits all that works here. Many different, modalities work in different ways with different people, but there are certain things that I do always focus on, and those are a few of the big pillars. So the first one is nutrition. Second is physical activity. Third is behavior modifications like sleep and stress. And then the fourth is medications, supplements, all of those types of things that can play a role. So I do always focus on all of those areas to really optimize health, prevent that lean muscle loss. That is really, honestly, for me, that is the key. And this is why I also check body composition often, because it's important to me that as my patients are losing weight, because if they're making the changes, they're going to lose weight, but we want to lose fat, right? We want to lose the visceral fat. We want to lose the body fat percentage. We don't want to lose that lean muscle mass. So first and foremost, we want to maintain it. Ideally, we want to increase it.
Mhm.
And it is possible to do all of that, but we need to be monitoring it and watching it, because most people, when they lose weight, they're losing a significant amount of lean mass, which, if you ask me, that is the number one thing that can help you live a long, healthy life, increase your health span, is lean mass. And so I want to, optimize that. So I'm helping them with things like their nutrition. We need to increase our protein intake, right? We need to be doing physical activity that is strength training, and that's doable. I mean, it might be, with exercise, I feel like, first of all, exercise is I don't like that word. We use physical activity, just like I don't like diet. I like nutrition, because we want to make this positive. Some of those words
Right.
are very triggering and can have some negative connotations. And so we want to, keep this positive, and we want to say this is a lifestyle change. We're going to eat healthy. That is not a restrictive diet. It's actually, probably most of my patients are eating more than they have before, because now we're eating the right types of foods. And I'm still eating my pizza. I still love my pizza with my kids, and I'll still do that. So it's not a restriction. It's just a prioritization. And then physical activity too is, something that people don't like to think about often, but we do need to think about it, and we need to, be doing both strength training and cardio. So we work on those things slowly and surely. And then we optimize the other areas like sleep and stress, which we know play a role in all these things that we talked about. Increasing visceral fat and increasing our insulin resistance. Sleep and stress play an incredibly important role with all of those things. So we really want to optimize all of those things. And if patients are candidates either for medications that can help with weight, or supplements, we talk about all of that. That's very individualized, and it may be something that's important. But I will say, if I do put a patient on an anti-obesity medication, a medication to help them with their weight, I'm really, really strict with watching muscle mass in that
That's
case,
good to
right?
hear.
Because we do know that you're going to lose more muscle, because you're going to lose more weight, right? So, we're really, really watching that very carefully, and making sure that that's not happening.
That's great. Yeah, I think that's a big role for body composition beyond just trending and seeing what happens, is sort of before starting a more intensive medication, even surgical treatment option, is really seeing where someone's at and then giving them that feedback up front of, you know, that you are taking you as an individual, not just making blanket recommendations about protein and movement. We're saying, you have low muscle. We need to protect that as much as possible. I think that's really a neat role for body comp in most all practices, really. Another thing I heard a little bit more about at this meeting, kind of talking in your four pillars and medication, is a little bit more about hormone replacement. And I thought Dr. Larkin, I think, was the one who did a good talk on kind of the history of, you know, there was a lot, maybe you can explain this better, but there was a lot of risk around breast cancer that was always feared, and how, more recent research is showing that is not the case. But there's been a kind of a gap in research and education to women about that. So there's a lot of people, and I hear that too, of, oh, I wouldn't want to get on a hormone replacement because of this risk. And so seems like this is a really important time for education to the public around what that risk may actually be. And then, what the role of hormone replacement could be for just symptoms in general, but also I think for the body composition changes. That's pretty interesting.
Yeah, right. This is, such a big topic, I feel like nowadays, because it all started, back in 2002 with the Women's Health Initiative. That was really misinterpreted. And I think, like Dr. Larkin was saying, her talk was amazing, by the way. I
I
really
love her.
enjoyed it. And I wish she would have had more time. I had so many questions. But she, really talked a lot about how, when she's one of the past presidents of the Menopause Society. And she said, back in that time, around that 2002 time, she was practicing OBGYN, and she was prescribing hormone replacement therapy, but this, the results of the Women's Health Initiative came out, and it was misinterpreted. And, all this information was spread that hormone therapy, is going to cause breast cancer. Do not use it. And
Hmm.
millions of women came off of this very beneficial treatment. And she said she read the study. She knew that that's not what it's saying. People are misinterpreting it. So she continued to give her patients hormone replacement therapy all throughout. But sadly, it was very much misinterpreted. Even medical schools and residencies stopped talking about it, stopped teaching it, which is just mind blowing to me, because the data is still the same data. It was just misinterpreted. And so then a couple years ago, the New York Times article came out saying that, this data was actually misinterpreted. It was really, they were looking at, a lot of the patients in that study were older patients who already had risk factors for cardiovascular disease. So and it was a huge, study. There's thousands of patients in that study. And so when we take that subset of population of the women that are less than age 60, and don't have those risk factors, those women do not have an increased risk of breast cancer. So, hormone replacement therapy can be significantly beneficial for them. And hormone replacement therapy, just to reiterate, is really talking about replacing that estrogen and progesterone that we're losing as we go through this transition. And sometimes testosterone is included in there as well, although there's no, FDA recommendation on that, in the United States at least. So we don't have an FDA recommended product for testosterone. But estrogen and progesterone can help with significant changes that occur during this time. Again, everything is, individualized. And this is where that, nuance of the art of practicing medicine comes in. It is really important to talk to a provider who's knowledgeable about this. Talk to your gynecologist, or, whoever you see that you trust that is knowledgeable about this, because I feel like a lot of gynecologists are still not prescribing HRT, following the older recommendations. And HRT can be given even in perimenopause, even if you're still having periods, even if you're still having regular periods, you can still be in perimenopause, which means we're seeing the transition of, symptoms, number one, number two, the body fat, shifting more from our hips area into our visceral area, the abdominal area, and causing that visceral fat accumulation and decrease of that lean muscle mass. So hormone replacement therapy, and I get this question a lot, can it help me lose weight, right? So it does not directly cause weight loss, but what it does do is it does improve that shift that's happening, right? But
Right.
with the visceral fat accumulation and the accumulation around the weight area. And so you're not going to see with it by itself so much of a change on the scale, but this is where we do see, visceral fat coming down, and then that lean muscle mass, right? Maintaining or perhaps increasing lean muscle mass, and estrogen and progesterone definitely play a role in that. Testosterone may too, but even just estrogen replacement does as well. And so again, this has to be so incredibly individualized based on what your goals are, what your family history is, what your risks are. But, in 2022, the Menopause Society did come out with a position statement saying that, first of all, it is, hormone replacement is the most effective treatment for vasomotor symptoms, which is like the hot flashes and night sweats, and the genitourinary syndrome of menopause, right? It even helps prevent bone loss and fractures. So it's important for all of those things, right? But it has to be personalized, and there has to be shared decision making between the doctor and the patient. And the Menopause Society statement also said that in general, the benefits of hormone therapy outweigh the risks in most healthy, symptomatic women, right, who are aged younger than 60 years old and within 10 years of menopause onset, right? So within 10 years, younger than 60, and you're having symptoms, or we're wanting to prevent the bone loss and fracture risk, it is definitely beneficial. But even then, again, personalized shared decision making is most important.
Wow. Yeah. So it sounds like for maybe an almost 20-year period or so, that's when, you're seeing the most women on that hormone replacement. I think that's also that kind of co-occurs with the average treatment age for folks or for women who are seeking obesity treatment too. I know from, in my practice in bariatric surgery, it was always average age is 43, 80% women, average BMI was in the 40s. So it was, kind of those co-occurring phenomenons are at an interesting time in life too.
That's right. The hardest time in life, right? And that's part of why we are seeing more weight gain during this time of life. It's because of our lifestyle, right? And when we're younger, things are different. As we're getting into our 30s and 40s, this is when we're out in the, workforce. So we are working more. We are, just more active, taking care of, either kids or a family or whatever. So there's a lot, that's on us, especially as women, especially as working women, right? We have a lot on our shoulders that we're trying to carry. So those stress levels tend to be higher. And then we're trying to do more and more and more, trying to make our days longer. So our sleep is decreased, right? And so when all of these things are happening, and in this society with a few things, with, people not prioritizing sleep, saying I'll sleep when I'm dead, right? Who's heard that before, right? Like that, we're not prioritizing sleep. We're just stressed all the time, which lack of sleep can increase your stress levels and cortisol levels too. But then we're also in this society of social media and, just being like hooked to this phone all day long,
Busy,
right? I mean,
busy and prioritize or, kind of thinking that that's a good thing.
yeah, I think it's a good thing, right?
Yeah.
Like it's kind of,
Multitasking is not so good.
right. That's right. It's not. None of those things are good for our brains and so, or our bodies. And so as we are not focusing more on ourselves and, not taking that time out for ourselves and that self-care, this is the time where women do start seeing weight gain. And it's not, it makes sense. It makes perfect sense from a metabolic standpoint that, this is the time where the weight starts coming on in our, 30s. Because actually perimenopause can also start in your late 30s, by the way. So, then we have all of that as women, right? So our hormones are shifting, we're taking more on, we're not sleeping well, we're not doing any self-care. It's a perfect storm for weight, and weight, the detrimental kind of weight, the weight that is going to cause the long-term health risks. And it's not just, it's not, weight is not just weight, right? It's like we're saying that visceral adiposity and just weight in general can increase your risk for cardiovascular disease, dementia. We know at least 13 different cancers are associated with excess weight. So, it is really impacting your long-term health and your quality of life, right? Just
Yeah.
quality of life in general.
Well, then by the time you make it out of menopause, you're dealing with the effects of all of these and sort of managing these other chronic health conditions, which is a whole nother phase of life.
That's right. And that's not what we want to do when we make it out of menopause, right? Like, I'm about to turn 50. I'm postmenopausal. I went through menopause in my 40s and finished at 48. This is a time in my life where, one kid is in college and I still have one at home, but, I'm getting to that point where I really want to be able to enjoy my life, and I want to be able to travel, and I want to be able to do all of these things that I do, with my friends and with my family and with my kids, and eventually my grandkids, hopefully, and all of that. So this is not a time where I want to slow down. This is not a time where I can even afford to slow down. I'm trying to advance my business. I'm trying to, do all these different things. And so it's a fun, amazing time, but it does take a lot, out of me. And so if we are not prioritizing our self-care, there's no way that we can do and accomplish all of those things, as we move forward in life.
Yeah, that's a lot. My brain always thinks of little Venn diagrams, and so I'm picturing all these little circles kind of collapsing into the middle to make it pretty hard. So then how does treatment or counseling or what you do shift once someone's sort of out of that menopause phase and they're in that postmenopausal area? They come off the hormones. Like what happens? I'm imagining too, they're getting closer to when bone health and that muscle mass loss is compounding on all these other health conditions. How do you shift those changes or pivot?
Yeah. And so again, it is very individualized. But right now, part of that statement, which was a big statement by the Menopause Society, but part of it is that, we're not really taking women off unless there's a big reason to come off of it. And so if you are starting it and you're finding it effective, then we stay on it. Now, if, you're at the age of 80 and, it might be causing, issues, or you're already at a point where you're feeling like I can, come off of it now, or maybe at that point cardiovascular risk disease does increase further, or lots of things can happen as we change and as we age. And so at that point, who knows, right? But it's really just kind of taking it literally year by year. And just like with all medications, I think, as a doctor, I want to be able to evaluate whether it's time to come off of it or not. Whether it's your weight medication, whether it's your diabetes medication, we always want to assess if it's time to come off of it. And that's part of why we need to continue to assess our overall health, not just look at that number on the scale. But if they are, continuing to increase muscle mass, and we're seeing these good shifts and they're able to maintain it, we can talk more about, coming off of medication, because that's my favorite thing to do is come off of medication if possible. But we always want to weigh those risks and benefits. And when we look at risks and benefits, one thing I want to mention is a lot of people think that looking at risks and benefits with a medication is the medication side effects versus not side effects. But that's not the risks and benefits. The risks and benefits are the medication side effects versus not doing anything, right? Which then we're talking, like I said earlier, cardiovascular disease, cancers, dementia, all of those things. And so that's what we need to weigh. And as that's why you have to see somebody who can really help you walk through all that and really figure out your individual risks and benefits.
Yeah, that's a good way to put it. I mean, I think we hear that a lot in the weight loss or the anti-obesity medication space, is people sometimes have this view up front of, oh, we're just going to be on it for a short period of time until we get the outcome we want, and then we come off of it. And we know, working with the chronic disease of obesity, that's not necessarily how that works for most people. So I'd imagine those are, kind of co-occurring conversations again for you when you're talking about hormones. And I'm imagining too many of your patients are on medication that's working. And so when it's working, we stay on it.
That's right. If it's working, we stay on it, because anything that we're doing to lose the weight, we want to continue through maintenance as well. And, that's not to say, everybody has to stay on it for the rest of their lives. But when we are talking about these anti-obesity medications, they are, they're definitely something that is helping you. That's why you're able to, get rid of some of that food noise that people who truly struggle with this chronic disease, really have a difficult time. It's not so easy to just say, don't eat that or stay away from that. It's not so easy. I struggled through it myself. I've been through it myself. So I understand that there was a shift, a difference when you start taking a medication that is changing that brain chemistry, that you no longer have this food noise that is, just circulating in your brain. And I think some people may not understand that. And so that is the difference. And that's why we do need to stay on it, because we want that weight to stay off long term. And that's incredibly important to make sure. And it's just like if you're taking a medicine for diabetes, which is another chronic condition, just like chronic disease, just like obesity. And if we take you off the diabetes meds, what's going to happen to your blood sugar? It's going to go up. If I take you off your blood pressure meds, your blood pressure is going to go up. So we cannot think of this as a short-term problem, because there's no short-term solution to a chronic disease, right? It is a long-term solution. It is a lifestyle change. And, think about it like this, it's either, we start a anti-obesity medication, and then you don't have to get on your blood pressure medicine, your cholesterol medicine. You don't have to get on diabetes medicines, because we're preventing all of these chronic diseases. We're preventing heart attacks and strokes, and we're preventing cancers. So it's, take this and prevent all this, or don't take this, and then it's going to continue to add on and on as we go through life, because we know weight and adipose tissue doesn't just sit there. It is pro-inflammatory.
Yeah.
It continues to cause problems long term.
Yeah, absolutely. Well, wow. I think that was, some of the key points from a couple of those sessions. It was a really great kind of specialized look at that for me. I have not been to a conference in this particular area before, so I definitely learned a lot. And I now that I know that you're virtual all over the country, I may have to reach out, because I'm in my early 40s. So so this is something that I need to start thinking about a little bit more, I think. So
Absolutely, we all do.
so how do we stay in touch with you? I know you're pretty active on social media. So for people to follow you, what's the best way to do that?
Yeah, you can follow me on social media. I'm on Instagram, Facebook, YouTube. It's Tula Medical Weight Loss and Wellness. That's TULA. My website is TULAWLW.com. You can set up a free consultation with me personally. I'll meet with you. We'll do an introductory virtual consult, and we can discuss your health and see, I'll give you my thoughts and opinions and see if my, plan or program would be right for you. I also have started to do live weekly talks on the app called Good Self, which if you've not heard of Good Self, it's a new app platform, and it is a free app. It's a social media platform for all things healthy, weight, and wellness related. All information given by vetted experts. So there's not, not all this, misinformation that we see a lot in social media. And I think it's fabulous. And I'm always on there once a week. If you go to my profile, Sejal Desai, MD, you will see my talks that are scheduled and the previous ones that have been recorded, because they also get recorded. And so I just recently started doing that, and I love it. And I'll be on in a little bit here. And so, yeah, I love doing that as well.
Okay, great. Yeah, I know they were getting started, so I'll have to check out now that you're doing live weekly chats. That's awesome. So yeah, we'll link to that in the notes, and then I'll see you at the next meeting, which the next OMA meeting in the spring is going to be in DC, but then the fall summit's going to be in Austin, so close to you over there in Texas.
Yes, I'm so excited about it. I'll be there in DC as well, so hope to see you there, and then I'll definitely see you in Austin. Thanks,
Great.
Nina.
All right. Well, thanks. Have a great rest of your day.
You too. Bye-bye.